Hi, this is Elaine. I'm back to give you an update on the follow-up that I had with my surgeon today for carpal tunnel release surgery. I did have my appointment this morning for physical therapy, and then also they removed my stitches, and I talked to the surgeon. Before I go there, I just wanted to give you a little hint, or I don't know, little tool that I came up with to help me not get my hand wet, because you're not allowed to wet it in until you see the doctor and they give you further instruction. At first, I was using a plastic bag and taping it around my hand to before I took a shower, and that was okay, but it was really hard to use the hand for like shower and washing your hair or whatever. And then I also use something called press and seal. You can put that on the incision and then just use like strapping tape around it, and it helped protect it from getting wet. But then I was driving along the other day and I thought, wait a minute, rubber gloves. I'm not one to use rubber gloves around the house when I'm cleaning, but I decided to go ahead and get some latex gloves. And so here's something I use, especially when I'm like cooking, because I don't want to get the bandage wet or dirty, and for washing dishes, and also for washing my hair. You could tape this down. I wasn't doing that. I didn't do that. I just kind of made sure that the water just flowed off of the glove, so it really didn't get wet that bad. I had a Band-Aid, a water-resistant Band-Aid on underneath, so that was enough protection. But anyway, I wanted to show you guys how cool that was, because I thought that was a good idea. And they're cheap. I got them at the dollar store, a bag for like 10 of them. But I did have my stitches removed, and I want to show you. Take this off real quick. The reason why I have that on, and they put that on for me, was because I'm right-handed, and for the first like 7 to 10 days, they want to make sure that you're careful with the incision, since the stitches have been removed, that incision doesn't open up. So he bandaged it up to give me some protection, and also to make sure that I'm safe with it. But here's my hand. If you can see it very well there. There were 5 stitches. According to them, it's healing really well. My physical therapist told me that once all the scabs fall off and it's closed, that I should rub this area up and down real good, so that it'll just look like a line rather than this big bump right there. So anyway, that's what's going on with my hand. The exercises were really simple. They tested measurements to see how far I can move my hand, making sure I can touch my fingers and make a fist and go backwards and forwards. And that's pretty much my exercises, open and close. They measured my left hand to see, and actually my right hand is better than my left hand. Saw the surgeon, and he asked me, the first thing he said is, did they wake up? Did your fingers wake up? And I told him no, that these 3 fingers are still pretty numb. There's a lot of tingling, numbness in these fingers. The problem at night is pretty much gone, but there's tingling here, and he said that pretty much they haven't woken up yet. I asked him if I should expect them to come back, and he said definitely. He recommended that I wait until this hand was a lot better before I do my left hand. So I'm going to give it maybe another month, because I want to get it done before the end of the year. I asked him, I said, I crochet. Can I crochet? And he said, immediately. You can crochet immediately. So I was really excited about that. So I've been experiencing a little bit of pain, right, primarily in the incision area. I have been working my hand pretty hard. I just kind of started back up all my normal duties, cooking, grocery shopping, doing all of that stuff. And so there's a little bit of heavy lifting, and they told me today at physical therapy, no heavy lifting on that hand for another 2 weeks, because they don't want the incision to open up. So I have to watch that. So I'm going to try to not overdo it and do stuff that I would normally do with my right hand, try to do with my left, or get somebody to help me. That's hard for me to do. So the pain, I have been taking some of the pain meds just to help take away some of the stiffness and the pain that I get with that. Other than that, it's been fine. I've been really more functional. I've been driving. Sorry about that. Something popped up on my screen. I've been driving, and that's been fine, and pretty much back to normal. Just a little bit of stiffness in the morning. Just basically, I'll just work my exercises and see how it goes from there. So hopefully these videos have helped you either decide yes or no whether to have it done, or make you feel more at ease about doing it. But yeah, if this has been helpful, I'm glad that it has been. Press the like button if you like it, and yeah, good luck if you're considering having the carpal tunnel release surgery done.